Thank you very much, Madam Speaker. Madam Speaker, I beg to move the following motion standing in my name. Whereas it is the responsibility of the Ministry of Health to protect, promote, and improve the health status of citizens, and whereas there have been numerous complaints from citizens regarding drug shortages and long waiting times for healthcare services at public health institutions, and whereas the report of the committee appointed to investigate the factors contributing to clinical outcomes of COVID-19 patients in Trinidad and Tobago also highlighted the existence of multiple chronic non-communicable diseases in our population, and whereas the government's approach to healthcare has failed to adequately treat with these public health issues, be it resolved that this House take note of the failure of the government to deliver on its health sector mandate. I beg to move.
Member, is it that you've finished everything that you intend to say?
No, sorry, Madam Speaker, I withdraw that. Second. Oh, seconded, sorry. Thank you. Thank you, Madam Speaker. Thank you for the opportunity to raise the following motion standing in my name on behalf of the opposition. Madam Speaker, it is a privilege to pilot a motion on such a critical sector as health on behalf of the opposition, and I thank the Leader of the Opposition for the opportunity. It is a common saying that health is your wealth. On a national level, the health status of citizens directly impacts on their productivity and therefore on the country's economic output. Some would say that proper health care is a human right. Is health a fundamental human right? Well, let us examine what has been said about this, Madam Speaker. The WHO Constitution 1946 envisages, and I quote, the highest attainable standard of health as a fundamental right of every human being, said some 70 years ago, Madam Speaker. In his 2017 Human Rights Day message, WHO Director General Dr. Tedros Ghebreyesus said, and I quote again, no one should get sick and die just because they are poor or cannot access the health services they need. So this is the status of health on the international front, Madam Speaker. He further went on to say, this is the Director General of the WHO, the central principle of the 2030 Agenda for Sustainable Development is to ensure that no one is left behind. And as I welcome you, Deputy Speaker. So indeed, we have heard a whole lot about the SDGs, the Sustainable Development Goals, and of course, health is a big factor in these goals. Indeed, as parliamentary representatives, we can all here in this House attest to the fact that requests for assistance for services in the public health sector rank very close behind requests for food and housing in our society and in our constituencies. So, Madam Speaker, I am saying that it should be in the interest of every member of this House for a critique of the healthcare system to be conducted on behalf of the many citizens who complain on a daily basis in this country. And I will come back to some of these complaints in more detail, Ms. Deputy Speaker, because it would seem that those who are unhappy with the state of the health sector come from all sectors of the society, including patients, their relatives, healthcare workers, and even some of our leaders. Before I delve into the motion, I wish to say this to the Minister responsible for health under this government, my colleague, the member for St. Joseph. The arguments I'm bringing here today to the attention of the government is on behalf of all the citizens of Trinidad and Tobago. Today is not only about critically analyzing the performance of the health sector, and one must appreciate that a critical analysis is required before improvements can be made. So it is not only about the critical analysis under your stewardship, but also about proffering solutions, and this I intend to do, Mr. Deputy Speaker, as I go along. So I invite you, my colleague, member for St. Joseph, to listen with an open mind to what the people have to say, because I'm saying this on behalf of the people. My observations and suggestions are based not only on my own experience as a medical practitioner, approaching some 40 years, including 20 years in the public health sector, 5 years experience in the UK NHS, and also experience as a chairman. So I've been there as chairman of the SWRHA, sitting in the, in the governance chair of the health sector. And in addition, Mr. Deputy Speaker, the COVID-19 pandemic would have revealed many shortcomings in our health sector, as stated in the findings of the committee that was appointed by the Honorable Prime Minister to investigate the factors contributing to clinical outcomes of COVID-19 patients in Trinidad and Tobago. This report is not the subject of this motion today, but it is just an observation from this report. So, Mr. Deputy Speaker, this motion is mainly about the fate of the regular healthcare system since this government took office in 2015, and especially in the face of repeated claims by the member for St. Joseph of a dual healthcare system, a so-called parallel healthcare system, to handle COVID-19 since 2020. Whilst the country was indeed fortunate to have a parallel healthcare system to treat with COVID-19 patients, built initially on the sound infrastructure left by the People's Partnership government under Kamla Prasad Bisesa at the Couva, Cora, and Augustus Long hospitals, but the evidence strongly suggests, Mr. Deputy Speaker, that the regular healthcare system suffered badly because staff and supplies were simply diverted to the parallel healthcare system, leaving patients and remaining staff to fend for themselves in an under-resourced regular health system. Mr. Deputy Speaker, I have no problem with this. Any government is entitled in times of crisis to so appropriate and, move the resources around. The problem I have is that you don't fool the population into believing that the regular healthcare system was still functioning normally. And Mr. Deputy Speaker, I have to ask, what has the government done to address the long waiting lists that resulted for clinic appointments, diagnostic investigations, and surgeries as a result of this situation? So, Member for St. Joseph, whilst I know it is your duty to defend your tenure over the past 7 years, it would be nice for you to do so in a circumspect and empathetic manner, and I say this with the greatest of respect, with a view to taking on board some of the healthy suggestions and solutions that will emanate not only from this side of the House, but from other stakeholders whom I have consulted and who have contributed and sent suggestions in preparation for this motion. Mr. Deputy Speaker, at some point in our lives, almost every one of us here, our family and our friends, will require healthcare services. And I just want to share an experience with the national population, and particularly for the benefit of those in charge of healthcare resources and administration. And I recall one morning before a board meeting as chairman of Southwest, I took fellow board directors and senior administrative staff onto the balcony of the old boardroom, looked across at the hospital, and I said, "You are doing this for you," and meaning that whatever we do as lawmakers, as administrators, as those in charge of governance, we are doing for us, each one of us, in the sense that we may all benefit, and it is therefore in our interests, everyone's interest, to ensure that the public healthcare system functions in a manner that provides timely and efficient service and represents value for money. But, Mr. Deputy Speaker, quite sadly, what we are seeing and have been seeing for the past 7 years is a massive shortcoming on the part of the Ministry of Health in this regard, or perhaps I should say an utter disregard on its part in fulfilling its stated vision. Indeed, Mr. Deputy Speaker, the first recital of this motion comes directly from the Ministry of Health's website to protect, promote, and improve the health status of citizens. Mr. Deputy Speaker, over $48 billion of taxpayers' money has been allocated to the Ministry of Health over the past 7 years under this government. Of this sum, over $28 billion would have gone to the regional health authorities. Yet, we hear daily cries from citizens of the poor treatment being meted out to them in public health institutions, sometimes no treatment at all, and in a few instances, even the wrong treatment. Many in this country will say that the Ministry of Health is failing in its stated vision to protect, promote, or improve the health status of citizens. Mr. Deputy Speaker, if I look at the second recital of this motion, the numerous complaints from citizens regarding drug shortages and long waiting times for healthcare services at public health institutions. And I just want to use a few examples, reported examples, to illustrate and to support the second recital in this motion, Mr. Deputy Speaker. So let's look at this one. Boy 13 gets surgery intended for someone else. And each of these reports from the newspaper, Mr. Deputy Speaker, has a lesson for what happens in the health sector. And hopefully, by sharing this information, we can all learn from this, especially those who are charged with looking after the healthcare services and looking after those who access healthcare services. So this is a situation here. It tells the trauma, and the article is reported in The Guardian, January 28, 2022, to quote, reported by Nikita Braxton Benjamin. And it tells the trauma of a young boy and his mother that had to go through because of a mistake made at the San Fernando General Hospital, when in fact, and just to summarize, Mr. Deputy Speaker, when in fact the child would have gone for an operation on one eye with a squint and was inadvertently operated on the good eye, the other eye. Very, very sad, very unfortunate, Mr. Deputy Speaker. Something that should happen to no one. I'm not saying that as a medical professional myself, there are errors that occur in health systems, but I'm saying that the RHAs, it reflects on the regional health authorities and in terms of the checks and balances in the RHA regarding surgical safety protocols. And indeed, there are surgical safety protocols in place, Mr. Deputy Speaker, and the question is, why are these not being or weren't adhered to in this particular situation? So, Mr. Deputy Speaker, when things like this happen, of course, it makes the public fearful of returning to public health institutions and undermines public confidence in the public health system. Another example, and I'm just using a few of these examples, Mr. Deputy Speaker, to make the point, reported on the Guardian newspaper of Wednesday, 16 February 2022, and it tells of an elderly man spending 72 hours waiting to be treated. According to one relative, when the elderly man arrived at the San Fernando General Hospital's Accident and Emergency Department in late January, they told him that they are not going to do any form of treatment unless he's tested. The problem, though, is that the test could not be conducted at San Fernando. It had to be sent to Mount Hope. And the bottom line of this one is that the conclusion of the relative was that the patient was not given any meals, no medications, not given any form of attention as a patient. So technically, the patient was sitting on the pavement of the hospital. Again, speaks to customer service within the public health institutions. Mr. Deputy Speaker, another report in the Newsday of Friday, 22nd January, speaks of a family's another traumatic experience, and this one related to the fact that a very ill patient had to wait some 2 hours for an ambulance. And again, it is a timely opportunity for us to review the ambulance service and the service we provide in terms of accessing and getting patients to healthcare facilities in such a small country as ours, Mr. Deputy Speaker. And then, of course, when citizens, encounter these sort of delays and poor service, they ask questions such as, has our healthcare system collapsed? And this is someone asking this question being reported in the media. This one, and I will probably just use this as the last example from the newspaper here, Mr. Deputy Speaker, but this one is important because it illustrates, again, when patients try to access health facilities. And Mr. Deputy Speaker, as a practitioner who worked in the public health service, I am very much aware that the quality of medical care in our public health institutions delivered by nurses and doctors is quite good. And, it's world-class standard. But what the issues that surround this seem to be is the access to care. And this is a great example. This is, and I quote here again, this is January 16, 2021, and this is a wife speaking about her husband. She took her husband to the Arima General Hospital after he suddenly fell ill. I'm quoting here now. Only to have hospital staff scold her on her parking instead of attending to her husband, who was having a heart attack. You know, Mr. Deputy Speaker, in this day and age, you would wonder. I mean, a relative is bringing a sick one into a hospital. The last thing you want to scold them about is where they park, when in truth and in fact, you should be dealing with the issue. But she followed and complied with the instructions. And Minister, I want to draw your attention to the fact that, the security at the public health institutions are really a first customer service representatives. They are the ones that the public comes into contact first with, and sometimes that encounter can make a difference between life and death. In our time in government, under the People's Partnership Government and the Honorable Prime Minister Kamala Prasad Bisesa at that time, we had taken steps to ensure that even those, especially contracted security, underwent and had proper training. And I'm hoping that this kind of this will is taking place, or will not happen again. So the patient, unfortunately, the husband died, but her grouse was that, she felt in her own heart that not everything possible, everything that could have been done was done. And in fact, I'm quoting here, she said that the insensitivity of the staff made the loss of her husband of 26 years that much harder to bear. She sent out an appeal, and I'm quoting, to Health Minister Terence Dialsing to ensure that medical staff is properly trained and the proper life-saving equipment is installed at hospitals. So I'm just quoting this patient's pronouncements to the media here, Mr. Deputy Speaker. So again, I'm calling, we have to look at the customer service that is provided in the hospitals. Now, that is customer service. What are the other aspects of the healthcare system that is being complained about? Another aspect of it has to do with infrastructure. And if we look at the Daily Express of Thursday, 24 June 2021, where the staff at the Point Fortin Extended Care Center have complained about a leaking roof and rat infestation. This is a center which houses psychiatric patients and the socially displaced. As chairman of the Southwest, I had visited this particular center, and they complained about rats and snakes and so on. And of course, this is demoralizing for the staff. And I just want to say that these are issues that need to be looked at. And again, I will come a little bit to the governance and the RHAs, Minister. And you have to ensure that there's proper governance and accountability within those who govern the RHA. Has your chairman, have your chairman gone to every single facility? Have they visited personally these facilities to see firsthand, chairman and the CEO, what is going on? That is something that should be happen on a regular basis. Mr. Deputy Speaker, I want to suggest to my friend, the member for Point Fortin, that he invite the chairman and the CEO of the SWRHE, under which this facility falls, to join him in a visit to that Point Fortin Extended Care Center to see firsthand the problems there and to fix it. Mr. Deputy Speaker, the litany of woes and complaints against the health sector goes on and on. I will limit my remarks in terms of the complaints. There have been several complaints. The RHAs are mandated by way of public board meetings to account to the public. And this is a newspaper report from the last public board meeting. And again, we have to be honest with ourselves in the health sector. And this is a comment here from a former medical director, Dr. Anand Chattogun, and the Minister of Health. The Minister of Health would have been well advised, Minister, to have kept Dr. Chattogun on as your medical director, because he would have solved many of your problems, Minister. But I leave that there. And your colleague, your colleague, the member for San Fernando West, Minister, is aware that Dr. Anand Chattergoon does not belong to the United National Congress, yet under the visionary leadership of Kamala Prasad Bisesa, she chose to appoint the best person for the job, and I see my friend from San Fernando West is smiling, and he knows that that is true. And he does not hold a UNC party card. I will not comment further, Mr. Deputy Speaker. I will leave that there for the time being. So, Mr. Deputy Speaker, as you can see, there are many, many issues that I've referred to: the long waiting times for clinic appointments, the long waiting times for surgeries, the lack of medicines, and other basic supplies. So, Mr. Deputy Speaker, moving on to the third recital of this motion, which speaks to the existence of multiple chronic non-communicable diseases in our population, as was highlighted. In fact, it was termed the NCD death burden in the Simongal report. I just want to indicate at this point, Mr. Deputy Speaker, that the whole issue of the chronic non-communicable diseases will be addressed by my colleague, the Member of Parliament for Komuto Manzilina, himself an experienced general practitioner and primary care physician, MP Dr. Rai Ragbir, when he makes his contribution, and other colleagues who will deal with other issues regarding to the overall health and well-being of our citizens. So that brings me to the fourth recital in this motion, Mr. Deputy Speaker. And I just want to read it again. And whereas the government's approach, and I emphasize approach, because this is broad, Mr. Deputy Speaker, and whereas the government's approach to healthcare has failed to adequately and effectively treat with these public health issues. So, Mr. Deputy Speaker, what has been the Ministry of Health and the government's overall approach to healthcare in Trinidad and Tobago? And if you will permit me, Mr. Deputy Speaker, to examine this government's approach to the health sector since they came into office in 2015, and just by way of comparison, to look at what the People's Partnership government did during the time 2010 to 2015 period, because I believe this is an important comparison, and it can show what differences in philosophy and policy, how that can benefit or not benefit citizens. So our approach in the People's Partnership government under then Prime Minister Kamala Prasad Bisesa, the PPG government, was similarly what I call the PPG model of healthcare, Mr. Deputy Speaker. What do I mean? The PPG model of healthcare, the P stands for people. We're always people-centered. We recognize people as an important human resource and looked after them, doctors and nurses and all healthcare workers, special way. The second P in the PPG stands for plant, the infrastructure. And I'll come to the track record of infrastructure in the health sector in a moment, Mr. Deputy Speaker. And of course, the G in the PPG as the basis of the health sector improvements regards governance, and this speaks to process, oversight, and accountability. So, people, how did we treat people? I give examples here, Mr. Deputy Speaker. Under the PPG government, under the partnership, every effort was made to keep young doctors meaningfully employed. In 2015-2016, Mr. Deputy Speaker, a situation arose in this country for the very first time where hundreds of young doctors who had graduated completed their internships and were unable to be offered jobs in the public health sector. And this is in a situation where there was a shortage of doctors and complaints about poor service in the hospitals. So, Mr. Deputy Speaker, I want to make the point that we cannot, as a nation, invest millions of taxpayers' dollars in training young doctors and then failing to employ them, especially when the health sector is facing so many problems. I believe that an urgent conversation needs to be had between the Ministry of Health and the Faculty of Medical Sciences, UWI, regarding the intake of medical students and regarding the synchronizing of intake with employment. And whilst one does not want to limit intake based on the wishes and the qualification and intentions of young doctors, young persons who want to study medicine, it's important that we have to find a place for them, if not within Trinidad and Tobago, perhaps within the CARICOM region regarding further regional opportunities. And this is a discussion that needs to be had. In fact, in Cuba, the system there is that the Faculty of Medicine comes under the Ministry of Health. It's a good health system where there's synchrony between the number of medical students and the requirements, the need for doctors. So that was our approach to employ them, make sure they were employed. In contrast, the current government's approach is to leave doctors unemployed, to give them short-term contracts, which affects their training, ability to specialize, and so on. And in fact, the worst we saw was where a team of experienced doctors was moved from the Couva Hospital at the peak of the COVID-19, something that may have very well affected the outcomes of patients. But I'll leave that there, Mr. Deputy Speaker. Our plan was to support nurses and nurses training. We had the Eldorado Nursing School. We created a category of staff called the Enrolled Nursing Assistants to assist the nurses, qualified nurses in the hospitals. And of course, we brought legislation in 2014 by way of the Nurses and Midwives Act to create the Advanced Nurse Practitioner and Nurse Intern. So we supported nurses. We understood the importance of nurses. We understood that they form a very important part of the healthcare sector. This government, they have allowed the nurses to fly the coop. The nurses have been treated badly. There have been situations where they're not encouraged to stay. And again, we saw situations where they were overworked and underpaid and stressed and so on. And that became very apparent during the COVID-19 crisis. Our approach would have been to make healthcare more accessible at health centers with extended hours. And again, this was important. It was part of our strategy to ensure that we strengthen primary healthcare, that we ensure that those who are working could go to a health center after 4 p.m. and get their blood pressure checked, get their numbers checked. They could do that on a Saturday morning and in some places on a Sunday morning without having to lose time from work. That was a very visionary initiative under our government. We also employed customer service representatives in the accident and emergency departments, Mr. Deputy Speaker. Their approach has been to discontinue the extended hours. What about the issue with plant and infrastructure? Well, of course, the PPG completed the Scarborough Hospital in 2011, Mr. Deputy Speaker. But unfortunately, the cardiac cath lab, which was in that hospital, has been abandoned since 2016. And my colleague, the member for Tobago East, is in the House. And member, I urge you to look into that situation. That is something that can benefit both the residents and the many tourists who come to Tobago. It's an important initiative, and you should perhaps look into that. We opened the San Fernando Teaching Hospital in 2014. That was our approach, Mr. Deputy Speaker. Because in 2010, when then Prime Minister Kamala Persad-Bissessar came into office, there was a situation at the San Fernando Hospital with regards to a shortage of beds. And her vision allowed the then incomplete office building on Chancery Lane to be converted into the San Fernando Teaching Hospital, thereby adding some additional 214 beds to the old teaching hospital. What has been their approach, Mr. Deputy Speaker? And this is something that is painful to me, because there are 2 floors in that teaching hospital, Mr. Deputy Speaker, which were designed specifically for training of doctors and teaching, right? And 2 of those floors have now been occupied, or since been occupied, by a human resource department. So a clinical space. The then board, with or without the permission of the minister, I'm not sure, chose to move their human resource department into a purpose-built space, and therefore that has been the approach, Mr. Deputy Speaker. So I'll leave that and I'll move on, Mr. Deputy Speaker. Mr. Deputy Speaker, we created a dedicated cardiac ward at the San Fernando Hospital in 2011 in anticipation of a cardiac catheterization lab to be built at the San Fernando Hospital. I'll come back and speak about that in a moment. We opened a new eye theater. But now we see that there's a long waiting list for cataracts. We provided the equipment for what is called VR surgery. It stands for vitreoretinal surgery. It is sight-saving surgery, Mr. Deputy Speaker, and especially with our high numbers of diabetics. If that surgery is not provided, then persons can lose their sights. What is the current situation? current situation for VR surgery is that the only place it's been offered in is in Tobago. Nothing is wrong with that, but it means that patients have to travel. It means that there's a long waiting, and therefore that is something that needs to be looked at. So before I leave the San Fernando Hospital, General Hospital, let me just come back to the cardiac catheterization lab. And I speak of this in the context of the high number of heart disease and cardiac cases. And we saw that patients with COVID-19 died because of comorbidities, cardiac disease being one of the main. And we do have that burden, and my colleague will speak about it. But I just want to point out that under the partnership, a space was identified in 2013-2014. A user brief was designed, and tenders were sent out to build that cath lab. When the government changed in 2015, they thought that they had to change the user brief and they had to retender and so on. That's fine. If that's the approach, that's fine. But how can you explain, Mr. Deputy Speaker, that 7 years later, we are nowhere closer to having the cath lab? The minister has made many pronouncements in this House. And again, I would want to ask him, on behalf of the population, that when he speaks, that he will give the assurance that this lab will be completed at the San Fernando Hospital in this financial year. So, Mr. Deputy Speaker, of course, I'm speaking about plant and infrastructure. Our response, our initiative was to build the Couva Children's Hospital in 2015. Mr. Deputy Speaker, what was their response? Their response was to close it down, to change the name of the hospital, and left it closed for 5 years until 2020, Mr. Deputy Speaker, until COVID came and they were forced to open the hospital. If this were not serious, Mr. Deputy Speaker, it would be funny, because for so many years it was touted as a construction site, and then within a matter of 2 weeks, it was able to be opened for the benefit of patients. But I'll leave that there, Mr. Deputy Speaker. Several other infrastructural developments we would have made in anticipation, of things that may come. We renovated the Augustus Long Hospital, and the modern operating theatre did serve as an ICU unit during COVID. But of course, their response would have been to shut it down with the closure of Petrotrin, and that has caused suffering to thousands of former employees and retirees. I will leave that for one of my colleagues to deal with. And Mr. Deputy Speaker, of course, we turned the suds for the Arima and Point Fortin hospitals. They built it eventually. It took 5 years to build. Again, fiddling with the specs and claiming that they save money. And this is a boast by this government of saving money by, redoing specs and so on. But the point I want to make here, Mr. Deputy Speaker, is that, what about the loss of health benefit for the residents of those communities in Arima and Point Fortin during the 5 years? So you're saving money, fine. But in the interim, I'm making the point that when you're taking so long and you're claiming to save money, you were increasing the disease death burden on the public purse in the meantime. In other words, patients who were not able to access these facilities would have gotten sick, and there would have been a greater cost to the public purse in the end. So really and truly, we have to look in terms of doing what is called a cost-benefit analysis, Mr. Deputy Speaker. So these hospitals are finally open, but still short of full staffing, and I trust that the Minister is taking all steps to fully staff these hospitals, especially with the fact that you have a number of unemployed doctors and nurses out there. Mr. Deputy Speaker, can I ask you how long I have again?
You have approximately 10 minutes, Honourable Member.
So, Mr. Deputy Speaker, in terms of process, we spoke about people, we spoke about plant, talk about the process. We created the External Patient Program, a very innovative initiative, Mr. Deputy Speaker. This was created in recognition of the limited capacity to meet with demand for investigations and treatment. What is the status of that program? I know it's still in existence, but I've had numerous complaints from constituents and others regarding difficulty in accessing this program. I don't know whether it is because of governance issues in the program or whether it is because of the funding issues. Mr. Deputy Speaker, I just want to move on quickly to renal dialysis, and I use this example Mr. Deputy Speaker, in terms of the government's approach to renal dialysis. And if you will permit me to read from the budget statement of 2022, not the budget statement of 2023, and this is the statement presented by the Honorable Member for the Martin Northeast in his budget presentation. And this is what is promised here, Mr. Deputy Speaker, in that budget statement. A National Center for the Treatment and Management of Renal Disease at the Couva Hospital was promised in the budget of 2022. Do you know, Mr. Deputy Speaker, that when the budget of 2023 was read, and I paid particular attention because I was interested, the treatment of renal disease in this country is very important. We have a lot of kidney patients, a lot of patients suffering renal failure. But lo and behold, when the budget statement of 2023 was read, not a single word, not a mention either in the budget statement of this promise, was this pie in the sky, and not a statement by the Minister of Health about this facility. So I asked today on behalf of the population, what has become of this promise? Is this really going to be built? Or was it just another empty promise by this PNM government? Mr. Deputy Speaker, I just want to move on quickly with regards to process and how we conducted business. And I just want to refer to what I would call 3 quality of care reviews. Quality of care reviews, every government comes in, they will do a review of different aspects of the health sector. In 2011, 2013, the partnership government, under the direction of the then Prime Minister Kamala Prasad Bisesa, got the Maternity Services Review Report, which we started implementation. We came out of office in 2015. We couldn't complete everything, of course. There was no politics involved in this. We were just there we had a committee which was across the board. I've mentioned the membership of this committee already in this House. The document is there for public perusal. So implementation was started. The minister, of course, will come and mention that the things that were achieved under his watch, but based on this platform, we have no problem with that. It has benefited the citizens of this country. It has benefited pregnant women, mothers, and we are happy. We are happy to have provided the platform for this government to build. We provided other platforms, of course, which they refused to run on, but that's another story, Mr. Deputy Speaker. So they quietly ran with this on this track. So in 2016, of course, the PNM government coming into office commissioned the Welch report, but they decided to play politics with it. And that has been politics every time it's asked. You are told that it was being brought to a joint select committee and it could not be implemented because we refused to sit on the joint select committee. Mr. Deputy Speaker, I want to clear the air on that today because the point about it is that that report did not require the expertise, time, or the expense of a joint select committee. It contained recommendations that could have easily been implemented. And I believe the ministry and the minister has now started to do that quietly. But where have they reached with regards to the implementation? And the fact of the matter is the implementation has been very slow. And this report was examined by the Public Administration and Appropriations Committee in this very House, and a report was sent to the ministry. And the findings were that the implementation rate of the recommendations was low. And again, there were hindrances such as the financial constraints, human resource management, time lag in approval and implementation for the design and approval of projects and work activities, bottlenecks of the procurement process for goods and services, and so on. And in fact, that PAAC report provided some very good recommendations to the Ministry of Health with regards to looking at these weaknesses. So what has been the response of the ministry, Mr. Deputy Speaker? Mr. Deputy Speaker, these reports from the PAAC look at current expenditure and look at the administration and so on of services. And the response is supposed to be brought back to the Parliament from the ministry within about 60 days. Mr. Deputy Speaker, it has been over 1 year, and I checked with the Parliament as recently as yesterday, and a response is yet forthcoming from the Ministry of Health on this particular report, Mr. Deputy Speaker. And one wonders, how it is that it can be taken so long for the Ministry of Health to respond to a parliamentary committee, Mr. Deputy Speaker. Mr. Deputy Speaker, as I close, I just want to reiterate I just want to quote from an Express newspaper article dated January 15, 2023, and reporting the following with reference to the state of the health sector. If ever visionary leadership is needed in the medical fraternity, it is now. Even before COVID-19 reared its ugly head, Trinidad and Tobago faced considerable challenges in its health apparatus. Lengthy wait times in hospitals, unreasonable delays in receiving critical diagnoses, results and reports, and confusing and unnecessarily complex administrative processes among the many issues experienced by patients at our institutions. I will leave it there, Mr. Deputy Speaker. I do not want to run foul of the standing orders of this Honorable House, but those are words that were spoken by a very high official in this country. And as I conclude, Mr. Deputy Speaker, I want to say that I will conclude my contribution on this private motion in the very spirit in which I started. Mr. Deputy Speaker, I believe that the evidence presented here this afternoon clearly supports the resolution of this motion, which is calling upon the House to take note of the failure of the government to deliver on its health sector mandate. But, Mr. Deputy Speaker, as I indicated in piloting this motion, it is in the interest of all of us in this House to ensure that the country has the best healthcare system possible with the resources expended. Our interest on this side has and will always be to continue to look after the welfare of each citizen of our beloved nation, whether it is to protect them from crime, from economic hardship, or to ensure proper health care for them. The Honourable Member for St. Joseph knows that he can still call on myself and my colleague, the Member for Komoto Manzalina, to discuss medical issues of national importance, and that we will speak in these circumstances wearing only our medical hats. It is in this spirit that the Leader of the Opposition, the Member for Siparia, met with the Honourable Prime Minister in 2020 during the onset of the COVID-19 pandemic to offer our suggestions on this side. It was in this spirit that the Honourable Leader of the Opposition made efforts in early 2021 to get COVID-19 vaccines for our citizens. And it was in this spirit that the Honourable Leader of the Opposition, in a budget contribution on 30th September 2022, gave commitments to this House and to the country for the improvement of the health sector, which I wish to repeat and endorse here today, Mr. Deputy Speaker, as I close. And these were stated in the budget, and I repeat, for the benefit of the population, the initiatives that we will keep when we get back into government at the next opportunity. So, Mr. Deputy Speaker, these are the words of the opposition leader in a budget presentation. We will immediately make the necessary legislative changes to the Children's Life Fund. We will implement a patient chart.
Honourable Member, just for the record, you have 2 more minutes. Right.
We will implement a patient charter with waiting times, guidelines, and timely care guarantees to address some of these issues I spoke about. We will re-implement the extended hours at the health centers. We will implement a way to do non-urgent surgeries on a weekend to deal with the backlogs. We will explore the potential capacity of other sectors to complement these initiatives. We will re-implement the health card to monitor dispensing of medication and detection of abuse. And, Mr. Deputy Speaker, we will introduce a mobile diagnostic unit with MRI, CT to ease the backlog and improve accessibility for non-urgent cases. These are just some of our plans as we prepare to take back the seat of government, Mr. Deputy Speaker. And with those few words, Mr. Deputy Speaker, I thank you.